Hi there and welcome back to the channel. I see high-risk pregnant patients for a living, but I frequently wish that people would come to me or to any of their primary care providers to talk about planning for pregnancy, because there's a lot that you can do that will enable you to get as healthy as possible before ever becoming pregnant. So there are a lot of reasons why your preconception consult might be with a high-risk provider rather than with your OB provider. I see people who have had recurrent pregnancy losses, or who have had previous pregnancy complications, or who have chronic medical conditions, or who might have a family history of genetic conditions. Talking with your provider before becoming pregnant can be really powerful because it gives you the tools and the knowledge that you need to take steps to optimize your health so that you're ready to become pregnant. There are several general steps that we follow in a preconception consult. And step one is your history and your physical exam. Do you have any chronic health conditions like diabetes, hypertension, asthma, or anything else that you're concerned about? Are you at a healthy weight? Do you have any family history of genetic conditions, birth defects, or anything else that concerns you? Do you have any behaviors like smoking, drinking, drug use that you need to stop and you need help with before becoming pregnant? Part of that history is your obstetrical history. Have you been pregnant before? What were the outcomes? Have you had miscarriages? Have you had babies with birth defects? Have you had a baby that was small at birth or large at birth? Did you have a cesarean delivery? What does that mean for your obstetrical future? Did you have any difficulties with a vaginal delivery? We can talk through all of that because many of us have a negative experience or something really scary happened with a previous delivery. We can put a lot of that to rest by talking about what might have happened and what can we do going forward that might prevent any complications from happening. Step number 2 is making sure you're up to date on any necessary vaccinations. We're all required to get vaccinations when we start school, things like our DPT and our measles, mumps, rubella vaccines. But there are vaccines for other conditions that we recommend. We recommend that you get a flu vaccine every year. RSV, respiratory syncytial virus vaccines, are also recommended. COVID vaccination is recommended. If you are reluctant to get any of these vaccines, let's talk about what your hesitation is and see if we might be able to get past some of that. And if you decide not to get vaccinated, then just understand what the risk is for you and your baby. In addition to that, there are some vaccines that it's not safe to get in pregnancy. So if you're susceptible to something like German measles, you want to make sure that you get that vaccine at least a few months before becoming pregnant. If you need a flu vaccine or an RSV vaccine, those are things that it's safe to get in pregnancy. But let's check your immune status before you become pregnant. The third step is screening for any kinds of infections or genetic conditions that might be affecting you. Are you concerned that you might have a sexually transmitted infection like syphilis, gonorrhea, chlamydia, or are you concerned that you have some risk factors for HIV? Now's the time to get screened so that we can treat that and address it before becoming pregnant. Sometimes people have a family history of genetic disorders, things like cystic fibrosis, a family history of clubbed foot, cleft lip and palate, heart disease, and things like that. There is a carrier screen that we can do that will tell us if you are a carrier for any of the common genetic conditions that might affect your baby. And if your carrier screen is positive, then we have the opportunity to also test your reproductive partner, because if both of you are carriers for the same condition, then we need to talk about what the risk is to have a baby affected with that condition. And the last very important step is behavior change, the actual counseling part of this visit. If you're diabetic, how well are your glucoses controlled? Because that has an enormous effect on babies starting from day one. So if your glucoses are not optimally controlled, let's talk about getting those normal and getting your A1C as normal as possible before becoming pregnant. Do you have high blood pressure? What kind of control is your blood pressure in? What kind of medications are you taking right now for anything that you might have going on? Are these medications safe to take in pregnancy? Do we need to talk about switching your medication to something that might be safer to continue in pregnancy? Now's the time to talk about that. How is your weight? Are you happy with it? If you're underweight or more likely overweight, what steps can we take to achieve your ideal weight or at least get closer to it before becoming pregnant? And let's have a plan for what we're going to do when you become pregnant so that we can optimize or minimize your weight gain. As you're leaving the appointment, we will probably want to give you a prescription for prenatal vitamins and extra folic acid. Prenatal vitamins are really important even if you have good nutrition, to make sure that you're not anemic, that you have extra iron on board, because that helps lower the risk that you're going to be anemic in pregnancy. Folic acid helps reduce the risk of birth defects, especially open spine defects. And if we have the opportunity to see you before becoming pregnant, that puts us way ahead of the game. So that's what happens in the course of a preconception consult. I wish everybody would talk with their healthcare provider before becoming pregnant. When you do make that appointment to come see me, be prepared. Come with a list of questions if you have them, any concerns that you have, no matter how silly you think they might be, and come with an open mind and an open heart so that you and I can work together to make sure your pregnancy is the best.